Are you struggling with painful popping or locking of one of your fingers or of your thumb? Well, it could be trigger finger or trigger thumb. It's painful, it limits your motion, and frankly, it gets in the way of you using your hands. Hi guys, I'm Michelle from Virtual Hand Care, and in this video, I'm gonna break down my top 5 trigger finger or trigger thumb mistakes preventing you from healing. Okay, let's just dive right in with mistake number 1, and that is ignoring the symptoms. It's fine, it'll just go away. If this sounds like you, then you may assume that your symptoms will just resolve over time or just on their own, and so therefore you delay seeking treatment. You ignore and you use your hand, your finger, your thumb as you normally would, and therefore it continues to pop or lock or get stuck a lot throughout the day. When in reality, this will cause the trigger finger or trigger thumb to be harder to treat, because the more it catches, the more inflamed, and therefore the more severe it can become. The other side of this is that for some people, ignoring the symptoms means avoiding just that finger or that thumb with daily activities. And what I mean by that is, so when you are grasping objects, you just don't use that finger or you don't use that thumb. So that finger is sticking out or that thumb is just sticking out, causing you to awkwardly hold objects. Because you know if you do, your finger will get stuck or you'll have a painful catch. Unfortunately, that doesn't work either, and that can make your finger or your thumb very stiff. And at that point, you've now created another problem. Okay, mistake number 2, that is overusing the affected finger or thumb. I just need to squeeze a ball and strengthen my hand more. This is the opposite of mistake number 1. You believe that gripping a ball or working on hand strengthening will heal the trigger finger or trigger thumb. Unfortunately, continuing to use the finger or the thumb with repetitive type movements like squeezing a ball or just continuing to use it and use it and use it repetitively, despite experiencing the symptoms, can make the condition worse. This repetitive use adds more inflammation to an already inflamed tendon, and therefore it will only prolong your recovery time. And because there are 4 grades of trigger finger, depending on the scale you use, you could worsen your condition. So if you started with a grade 2, which is just a little catching here and there, you could end up with a grade 4, which your finger could end up completely fixed or locked and you're not able to bend or straighten it. Okay, mistake number 3 is not seeking professional help. Some people may try to self-treat their trigger finger or their trigger thumb without consulting a healthcare professional. It is essential to see a hand surgeon to get a proper diagnosis, because trigger finger or trigger thumb can be easily confused with other conditions like Dupuytren's disease, metacarpal ligament injuries, sagittal band ruptures, and so many other conditions. And the treatment is not the same, so you could be wasting your time and your money doing the wrong treatment. And so for those reasons, I always recommend to see a board certified hand surgeon to get a proper diagnosis. Mistake number 4 is not trying conservative treatment first. Many people will just dive right into injections or surgery without trying less invasive solutions such as splinting or stretching, exercises, anti-inflammatories, rest, and so on. In fact, one study found that around 60 to 70% of people with trigger finger experienced improvement with conservative treatment. And another study found that up to 80% of patients with mild to moderate trigger finger improved with conservative treatment. Keep in mind, conservative treatment usually takes a combination of splinting and stretching and exercises. And in fact, an exercise that I've had great success with and has been found as being an effective way of treating trigger finger is an isometric pulley exercise. And I do have a video of how to perform that exercise as well as several other conservative treatment ideas, and I will link that video here. And finally, mistake number 5, and that is trying to rush your recovery. This means not following your treatment plan for the length of time recommended. Patience is definitely needed when it comes to healing trigger finger or trigger thumb. It can take a long time for the triggering to stop and for the pain to stop. Sometimes it can take 6 to 8 weeks, but it can take even longer. So if you're not following your plan accordingly, this can slow your recovery time and it could even make your condition worse, because what could have healed in 2 months is now going to take a lot longer. And in fact, one study showed that out of 343 patients with trigger finger, 52% resolved without any treatment whatsoever. That's spontaneous resolution of their trigger finger and their trigger thumbs. But this was after an average of 8 months after they saw their doctor for their initial consultation. So I rest my case that patience is key. And you can't rush it no matter how hard you try. So to recap my top 5 trigger finger or trigger thumb mistakes preventing you from healing. First, don't ignore your symptoms by not using your hand. And then on the flip side, don't overuse your hand and make your condition worse. Also, seek professional help from a hand surgeon. And always try conservative treatment. And I'd like to add to see a certified hand therapist to help you with a customized treatment plan. And finally, don't rush your recovery. Follow through with your treatment plan. Now, with all that said, sometimes surgery is needed, and there's nothing wrong with that. But with surgery comes cost and time lost at work, post-operative pain, incision care, swelling, and stiffness. So just make sure you pick the method of treatment that is right for you. Now, I hope you found this video helpful. If you did, please give it a like and hit that subscribe button below. And watch my top 5 trigger finger treatment video that I'll link here to help you find solutions for your trigger finger. Until next time, thanks for watching.